Whether you've heard of non-surgical spinal decompression or not, it's a relatively new term for most lay people and even for some doctors. So, how does decompression therapy work? So let's take a look at a normal spine. Here you have normal joints, including the vertebrae, with a normal disc height. The discs have two primary functions. First, they act as shock absorbers for the spinal joints. Second, they act as spacers between the vertebrae. When a disc is healthy, it creates a space between the bones, which creates a hole so the nerves can exit healthily from the spine. Each level of the spine has two nerves that exit and go to every tissue, organ, and muscle in the body. They carry messages to and from the brain. The discs are about 70% water, so the movement of the bones pumps fluids and nutrients into the discs and keep them healthy. Here's what it looks like when the discs start to break down. As the movement in the vertebrae decreases, the disc becomes dehydrated. As it does, the space between the vertebrae decreases, which narrows the space where the nerves exit. This can cause nerve compression and pain. Also, as the disc ages, dehydrates, and starts to crack, the edges of the disc can start to bulge. This bulging can also put pressure on the spinal nerves. Now this is what it looks like when the center of the disc, called the nucleus, starts to ooze through the cracks towards the side of the disc. That pressure causes a bulge on the sides of the disc. When that bulge increases to the point where it pushes into the area where the spinal cord or the nerve exits, this is called a herniation. Here's what a spine would look like as it undergoes spinal decompression. Decompression pulls the joints apart, taking pressure off the nerves, and this highly specialized process creates negative pressure within the disc with a resulting vacuum, which literally sucks the bulging or herniated material back into the disc. This also rehydrates and nourishes the disc. During this part of the procedure, the doctor will set the computer to operate on different cycles to correct different conditions. If your disc is bulged, the setting would include the intermittent pulling and relaxing so as to milk the disc. If the disc is herniated and the tissues are torn, it would stimulate the body to create new cells, which would actually attach to the outer torn ligament bands of the disc and heal over the torn part with fresh new cells.